Hello, everyone. First of all, I would like to introduce myself. I am Samoza, a Master in Philippine Studies with specialization in Philippine Foreign Relations at the Asian Center University of the Philippines, Diliman. So as part of our requirement for AS211, I will be presenting my research paper entitled Health Silk Road, Evaluating China's Vaccine Diplomacy in the Southeast Asian Region. So, hold on. On your screen, is the outline of my research paper. So first, I will present the basic information and or background of my research paper, followed by the research questions, and then the discussion proper. So this paper will explore how China utilized the opportunities presented by the pandemic in fostering cooperation with other countries, specifically the ASEAN region through the Health Silk Road vaccine efforts. Then I will also present data containing information on how the HSR efforts affect the relationship of China in the region. So this paper argues that China's vaccine diplomacy in the ASEAN region has provided opportunities towards a more deep bilateral cooperation, but it has a limited effects or influence on issues concerning existing issues concerning China and ASEAN member states. So the best vaccine is the vaccine in your arm. So this is one of the quotes from Dr. Edsel Salvania of National Institutes of Health. These remarks basically implies that with whatever brand of vaccine, as long as it passes the WHO requirement on vaccine efficacy, is effective against the novel coronavirus. This premise serves as one of my, parang on a personal note, this serves as one of my consideration why I chose this research topic. So the COVID-19 pandemic, so the background of the study, the COVID-19 pandemic has brought an interruption of status quo affected economic activity, which was brought by lockdowns, community quarantines, as well as temporary business closures. So in a report compiled by Organization for Economic Cooperation and Development, or OECD, it was emphasized that the growth of the ASEAN member countries deteriorates during the protracted effects in the economy of the COVID-19 pandemic. Like for the Philippines, according to the NEDA, or the National Economic Development Authority, the initial forecast and official target was 6.5 to 7.5%. But as the COVID-19 affects the Philippine economy, the forecast was revised to negative 0.06 to 4.3%. Furthermore, the COVID-19 pandemic has exposed the country's vulnerabilities in responding to non-traditional threats such as the global pandemics. Countries which has the capacity of conducting research and development are currently in a global race to search for safe and effective COVID-19 vaccines. With the ongoing development of vaccines through the conduct of clinical trials and limited use approval, some countries are now using the tools and machineries of the diplomacy, particularly vaccine diplomacy, to pursue a soft power approach to other countries to secure vaccine doses. So with the premise that in order to achieve herd immunity, according to the WHO, 70% of the world's population must be inoculated by the COVID-19 vaccines in order for us to revert back to our normal life. Thus, this poses the question, how will the vaccine developers around the world would supply approximately 5 billion of the world population in order for us to achieve herd immunity? So at the onset of the pandemic, China rose as one of the major players in the global vaccine race, having numerous foreign vaccine developers and biotech technology companies in research and development for COVID-19 vaccines. So China's vaccines were shipped to more than 53 countries with emergency use approval for limited use of vaccines. And these countries received the vaccines either through donation or through government procurement. So with the ongoing pressure for the world to produce COVID-19 vaccines to supply the world, ASEAN has been the recipient of China's vaccine diplomacy, under the umbrella of the Belt and Road Initiative through the HSR for COVID-19 vaccines. So this is the focus of this presentation, which aims to answer following questions. So how did China, through the Health Silk Road, utilize the opportunity for vaccine insecurity in further fostering relationship with Southeast Asian countries? What are the contributing factors in choosing and rejecting the Chinese vaccine brands in Southeast Asian countries' immunization programs? And how will these efforts affect the perception of Southeast Asian countries to China? So we'll now proceed to the discussion proper. In 2013, China unveiled the Belt and Road Initiative to further promote and expand trade infrastructure for over 65 countries around the world. While at the onset of the COVID-19 pandemic, Chinese officials utilized the Belt and Silk Road and shifted to utilize the Health Silk Road to serve as a mechanism to provide medical support to other countries in the world. China has successfully sent teams of experts provide medical auxiliary services, capacity building activities like training sessions for treating patients with COVID-19. The Health Silk Road has always been part of the Belt and Road Initiative in Belt and Road Initiative. In 2015, China unveiled a document titled a 3-year implementation plan for advancing BIR health cooperation. So this implementation or plan has a framework that promotes international health cooperation, which paved way for the Health Silk Road. So the document emphasizes the critical role of health to the success on the implementation of the Belt and Road Initiative. And in order to secure this, increasing health infrastructure, continuous people-to-people exchange would create this idea of blanket of security to China and BRI countries on the implementation of BRI. So as the spread of the COVID-19 virus continue to affect other countries, specifically BRI countries, China sees the vital role of further implementing the Health Silk Road in support for other countries as they combat the pandemic. China provided countries large quantities of masks and personal protective equipment, and it was labeled by scholars as medical diplomacy. So it is a provision of large quantities of medical equipment, masks, PPEs, as well as capacity building activities for other countries. So another diplomacy that China has explored is the vaccine diplomacy. It is the provision of large amount of vaccines to countries through various mechanisms like donations, bilateral agreements, or through multilateral agreements. So with numerous pharmaceutical research institutes and biotechnological companies searching for a COVID-19 vaccines, several companies became at the forefront of COVID-19 vaccine development landscape. So, but before we dig on China's vaccine diplomacy, I would like to provide you a brief information or overview on the concept of vaccine diplomacy and how countries take advantage of the health crisis to pursue and promote collaboration. So basically, vaccine diplomacy serves as a mechanism for cooperation between countries or organizations in responding to health crises such as pandemic or even eradicating the disease. As Dr. Peter Hotez has noted, vaccine diplomacy has proven to drive cooperation through foreign policies in times of crisis to help solve or even eradicate disease. So as an example, during the Cold War, the US and the USSR collaborated to develop a prototype polio vaccine and was tested to 10 million Soviet and approximately 100 million people. So another example would be in 1970s, several efforts were also initiated globally to successfully eradicate smallpox in developing countries. So United States is at the core of this initiative, which has provided financial support aiding countries combating the smallpox disease. So these examples clearly show how vaccine diplomacy promotes collaboration among countries or states to achieve a common goal of combating or even eradicating disease. So in order to provide you how vaccine plays a crucial role in state-to-state relationship, during the COVID-19 pandemic, I would like to show you the short video from Reuters titled "The Vaccine Diplomacy Era Has Dawned." The vaccine diplomacy era has dawned.
The world has a new tool for soft power: COVID-19 vaccines. Large producing nations are cutting deals for foreign allies or countries where they seek influence, despite pressing needs at home. China is hashing out agreements across Africa. Israel's Prime Minister Benjamin Netanyahu is under legal scrutiny for sending shots abroad. And Russia is distributing across resource-rich Latin America.
Ellos están compartiendo esta vacuna cuando todavía no terminan su vacunación en su país. Entonces tiene un valor todavía más grande de simpatía o de cercanía con México al enviarnos estas vacunas. No es una donación, estamos pagándolas, pero si el gobierno ruso no lo permitiese, pues no podríamos tener acceso a ellas el día de hoy.
In the Philippines, the government even offered to trade health workers in exchange for vaccines from Britain and Germany.
When we first read and heard about it, siyempre we are saddened and we were hurt, no? Kasi siyempre, as if we are like an object na pwede bang ipalit with the vaccine. No? Sabi nga nila, para kaming commodities.
There is perhaps nowhere this new brand of diplomacy is more evident than the world's biggest maker of vaccines, India. Prime Minister Narendra Modi is leveraging supplies to strengthen regional ties and push back against its rival, China. It's only just got its domestic immunisation programme up and running, but India has already supplied at least 15.6 million doses of the locally made AstraZeneca vaccine to 17 countries, either through donations or commercial contracts. Some Indians have criticised the government's focus on exports, when they say more needs to be done to inoculate at home. Critics say so-called vaccine diplomacy is undermining efforts to create fair distribution. The World Health Organization urged nations against distributing vaccines unilaterally. It says one-on-one deals undermine its global scheme, COVAX, and its goal of equitable access.
So, in this video, it was emphasized that vaccines being used as a mechanism for soft power. Countries are now negotiating to cut deals with foreign countries to secure vaccine doses, anchoring on the premise that there is a limited supply of COVID-19 vaccines. China, Russia, India, and Israel were identified as the major players in this quest of pursuing vaccine diplomacy. There is an insufficient supply of COVID-19 vaccines, and in order for us to there is this idea of insufficiency of COVID-19 vaccine supply. So in order for us to recuperate from the effects of this pandemic, as I've mentioned earlier, and as WHO has noted, herd immunity should be a matter of priority. So for this research, I would like to reiterate that the purpose of this research is to try to answer the questions how China utilizes the gaps and opportunities of the pandemic in supporting the ASEAN member states responding to the pandemic. What are the contributing factors in choosing and rejecting Chinese vaccine bans in their immunization program? And lastly, how did it affect the perception of AMS to China? So on your screen, you will see that currently there are 6 Chinese vaccines which were approved in China and other countries. So these vaccines were developed by Anhui, Fei Longcom, CanSino, Minhai, Sinopharm, and Sinovac. So I would like to put emphasis on Sinovac and Sinopharm because of out of the 6 vaccine candidates, these vaccines were approved by many countries for emergency use. So furthermore, aside from this approved use, there are currently 22 vaccine candidates conducting clinical trials in China. So these are Anhui, Lipson, Sinocell, National Vaccination Institute, and so on, ranging from different vaccine platforms for clinical trials. So at the purview of China's foreign policy, China has expressed its commitment to the world that vaccines should be a matter of public good. This was emphasized during his speech at the opening ceremony of the BOA Forum Asia Annual Conference 2021. China sees the importance of providing equitable access to vaccines, specifically those countries which belong to the lower and middle income countries who do not have quick access and to COVID-19 vaccines as well as capacity to develop COVID-19 vaccines. And President Xi Jinping in April 2021 directly opposed vaccine nationalism, expressed his willingness to work with international community to support and help developing countries to obtain vaccines in timely manner. So, just like what I've mentioned, herd immunity is still a matter of priority. So following this, ASEAN became one of the recipients of China's commitment in response to vaccine nationalism. ASEAN region has received millions of doses from Chinese foreign vaccine developers. Because of the region's inability to keep pace with the fast and quick development of COVID-19 vaccine, most of the ASEAN countries rely on the global vaccine supply chain. So as you can see on the screen, support to the ASEAN were expressed by providing vaccines from Chinese authorities. Support of China could support of China could also be in the form of bilateral donations, multilateral agreements through COVAX, or even private donations. So COVAX facility is a global initiative for pooling COVID-19 vaccines and delivering it to low and middle income countries. So basically, it is a global initiative for equitable access to vaccine. So as you can see on the screen, this as the ASEAN magazine August to September 2021 issue had a compilation of data indicating the ASEAN member states received large amount of COVID-19 vaccine doses. As you may have observed, majority of the vaccines received by ASEAN member states are Sinovac and Sinopharm vaccines. So for information, Sinovac and Sinopharm vaccines are the two COVID-19 vaccine candidates who earlier reached the phase 3 clinical trials. So one should probably think why did most of the countries accept and receive Chinese COVID-19 vaccines, particularly Sinovac and Sinopharm. So I have listed the reasons why some countries chose to include Chinese vaccines in the immunization program. So first, the fast-moving research and development of these vaccines. So basically, countries must evaluate the safety and efficacy of COVID-19 vaccines based on the preclinical trial to the phase 3 clinical trial data of the vaccine. So because Sinopharm and Sinovac were able to reach phase 3 clinical trial, these vaccine developers were able to provide clinical trial data as well as interim phase 3 clinical trial for emergency use for countries' evaluation. So in fact, Sinopharm and Sinovac is currently at the last stage of clinical trial and was able to provide clinical trial data for evaluation. So like in the Philippines Food and Drug Administration has granted an emergency approval for Sinovac and Sinopharm after a strict scientific evaluation of their interim data. So just a quick information, emergency use were given to vaccines for a limited use despite that studies of vaccines are still ongoing. This is in consideration that there's an ongoing health emergency and vaccines would really help curb such health emergencies. So next will be vaccine efficiency. So vaccine efficacy is also being considered, but with limited regard in choosing vaccines to be administered. So in an article from Nikkei Asia, it was noted that Indonesia would not be able to start its mass vaccination without the Sinovac shots. So Sinovac. So as you can see, Sinopharm and Sinovac, WHO has identified the vaccine efficacy rate of Sinopharm and Sinovac. Thus, with this information, it has been argued by authorities that as long as these vaccines fall within the prescribed WHO vaccine efficacy rate, Well, that is, vaccines must have a high efficacy rate of 50% or above. These vaccines can be used for vaccination programs. However, at the popular level, despite of the data on Chinese vaccines efficacy rate, there's still a relatively hesitancy, towards Chinese vaccines, as Kairulanwar Rami and Huang Tiha's article. It was noted that major factor that influenced in the relative vaccine hesitancy of Chinese vaccines is vaccines efficacy. Like for Indonesia, according to a July study in 2020, respondents would get a COVID-19 vaccine provided that it has a 95% effectiveness rate, in contrast to a 67% percent of respondents who will receive COVID-19 vaccines that has 50% vaccine efficacy rate. So last factor would be the vaccine developers' capacity to produce this vaccine. So Sinopharm has reported that it could offer more than 1 billion COVID-19 vaccine doses to other countries outside China, while Sinovac could produce at least 2 billion doses of vaccine per year. So this factor is given importance because vaccines needed 2 or more shots to reach this vaccine efficacy, hence requiring a large quantity of vaccine doses. This also serves as a factor towards further developing China's bilateral cooperation with other countries, anchored on the capacity of the ASEAN member states and China for local vaccine production. So this idea will be presented on the latter part of the presentation. So through these factors, ASEAN countries were motivated to consider these vaccines as part of the immunization program and to continuously negotiate supply of vaccine through numerous mechanisms. So now that we have an idea on how China used vaccine diplomacy in the ASEAN region, it would also be important to explore and evaluate how these efforts affect the perception of the ASEAN member states towards China. With the limited literatures available, I'll be using the survey report conducted by ASEAN Study Center and ICEAS Yusuf Ishak Institute, titled The Survey Report Conducted by the State of Southeast Asia 2021 Survey Report. So on your screen, you will see how China enjoys 44.2% highest rate as the highest 44.2% rate, which is the highest rate for the most helpful partner in the ASEAN region in responding to COVID-19 pandemic. So to give you an example, Indonesia's total bilateral trade still increased by 50.3% compared last year on the same period. This is during the COVID-19 pandemic. So Indonesia is also one of the countries where there is a production of COVID-19 vaccines. However, as the survey noted, issues in the South China Sea, particularly China's militarization and assertive actions in the disputed territory, still is the top concern of most of the ASEAN countries. Despite the sentiment on how helpful China to ASEAN member states, it did not affect the behavior of AMS towards other issues like the South China Sea dispute. Furthermore, the survey also shows that while ASEAN countries recognize China as the most influential economic power in Southeast Asia, they still worries in the growing economic influence of China in the region. And the result of the survey is notably high. So from this, we could observe that despite of the support of China in the ASEAN region, there has a limited influence towards the perception of China in the ASEAN member countries. So furthermore, another factor that I consider that would possibly influence the perception of ASEAN and its member states towards China is the perceived outcome of the ongoing negotiation with some AMS in establishing a local vaccine facility that would serve as the hub towards vaccine self-sufficiency. So as you can see, Malaysia, Indonesia, Laos, Myanmar, and the Philippines has an ongoing partnership or ongoing negotiation with China that would help address vaccine insecurity in the region. However, it would be premature to assess this factor on because, as I've said, this negotiation is still a premature one. So as a conclusion, China has indeed utilized the opportunities of the COVID-19 pandemic in accelerating the country's foreign policy under the umbrella of Belt and Road Initiative's Health Silk Road, which navigated both medical and vaccine diplomacy. So recognizing the gaps of other countries, specifically the low and middle income countries, in responding to the protracted effects of COVID-19 pandemic, China rose as one of the leaders of the developing countries, or the LMICs, in support to their COVID-19 response, COVID-19 pandemic response. So China, being one of the major players in the global vaccine race, has taken advantage of the interconnectedness and established bilateral cooperation with ASEAN member states by further advancing and supporting the ASEAN member states through providing them a COVID-19 vaccines through COVID-19 vaccines through various mechanisms. However, the ASEAN region may have recognized the support of China in combating the pandemic, but it could be observed that this support has a limited influence towards existing issues between China and the ASEAN member states. I also recognize that the development of the current pandemic, such as the existence of various COVID-19 variants, could also influence a change in the mentioned areas of evaluation for COVID-19 vaccine diplomacy. Like, for example, the phasing of Sinovac vaccine in Malaysia because of some reasons, as well as the development of possible support from Chinese manufacturers to achieve vaccine self-sufficiency in the region. So, as I said, these developments may change China's health Silk Road approach towards ASEAN member countries, as well as the approach of ASEAN member countries towards China. So thank you very much for listening.